So I'll now go to my now well-renowned weekly presentation, and I will also talk a little bit about our testing capacity and the Pandemic Intelligence Plan. So this is a familiar graph to all of you, and pretty convincingly we have flattened the curve. And you can see that our numbers of cases each day continue to be pretty flat. Next slide. This I showed you also last week, and this is the forecast of what the predictions from the previous case numbers that we would likely get, and you can see again that we are having case numbers that are below the median predicted case number, so we're doing better than the modelling would have predicted from the previous data. Next slide. Now you'll note that there are only 2 jurisdictions left on this effective reproduction rate number. That's because although other jurisdictions have had cases, remember last week I said ACT and the Northern Territory had a badge of honour by dropping off by not having any cases, but the case numbers in every other jurisdiction are so small that the modellers feel that they can't usefully use the effective reproduction number. Those error margins are so broad in the other jurisdictions that the modellers aren't comfortable with producing them. Only in New South Wales and Tasmania are there enough numbers to show an effective reproduction number, and even then they're pretty much at the lower limit of what you would expect. And you can see that Tasmania is comfortably now below the 1 benchmark, as they have so expertly brought the Northwest Tasmania outbreak under control. And we do continue to congratulate the Tasmanian Public Health Unit and all of the people of Northwest Tasmania for complying with what was a very burdensome but necessary public health intervention. Next slide. This is a new measure, and we have this in the modelling paper that will be published on the Doherty website tonight. We'll show this for every jurisdiction. We're only showing it here for New South Wales because it becomes a very busy slide if we show too much. Basically, this is showing measures that people are adhering to distancing measures. So this is for New South Wales, showing when we introduced those measures. For Apple, it's given us data on directions for driving. You can see that directions for driving have dropped dramatically. Google has got data on time at transit stations. Again, that's dropped. But the converse is the Google data on times at residential. Google does track people. The COVID Safe app doesn't, but this is showing that how well people have adhered to our measures that we've put in place. And you can see some little spikes around the Easter time, but generally people are doing the right thing. Next slide. So I said before that the effective reproduction rate is not really a valuable measure at the moment because case numbers are so small. So what we have now presented to the National Cabinet is this Pandemic Health Intelligence Plan, and we'll need to be looking at things that are much more granular than the effective reproduction rate. Our case numbers are so low now that we can analyse each case, each cluster, and get really detailed epidemiological information on what's happening. And so we can get a feeling of whether there is a cluster that's breaking out and that we need to control. I've mentioned all of those parameters of the Pandemic Health Intelligence Plan before, but I do want to go into our testing strategy because this is really quite important. We've done a lot of work on that. As I've said on this meeting on many occasions, we need to test more people. If we are going to get on top of those small outbreaks, and we've seen a couple of them just in recent weeks, a couple in Victoria, and they've got on top of them expertly and well and contained them, but we cannot afford to have an outbreak that takes off so that we get a second wave when we reduce restrictions, such as a number of other countries have seen. So our testing has to be very, very good. The most important thing in testing is for everybody who has any respiratory symptoms, a cough or a cold or a sore throat or a runny nose, please get tested. It's safe to get tested. There are testing centres. GPs can do testing. They can send you to pathology labs. It's very simple and straightforward. We want everybody who has a cough or a cold or any respiratory symptoms, because most people with COVID-19 have mild symptoms, just like a cough or a cold. Get tested and don't go to work, or don't, particularly if you work with vulnerable people. That's the most important thing. But we're also doing testing in a lot of other settings. Any outbreak in an aged care sector, as Minister Colbeck said, we have done extremely well in most of those outbreaks. Sure, there have been some very troublesome ones and one that's very active at the moment. But in most cases, once you get one case, we go in and test every staff member, every resident and any potential contact. And that's been enabled us to identify very quickly and exclude infection in others. Any healthcare setting outbreak, we will test all the healthcare workers, all the other asymptomatic patients. Every contact, of someone with COVID-19 is now going to be tested to make sure that we chase the contacts very actively and make sure we lock that down. We have talked, there's been a lot of talk about what's called active surveillance, where you test well asymptomatic people in the community. Given the current very low positivity in testing, that does not seem to be a very effective way of monitoring this virus. However, we are going to do what we call cohort tests. So we want to assure the community and sample sections of the community just to make sure that our confidence that we don't have significant asymptomatic transmission is correct. So we will be doing some testing of some consecutive elective surgery patients just to reassure that those people coming in for surgery and the hospital staff that we're not having cases in that group. We will be also testing aged care workers voluntarily, if they wish to, even though they're perfectly well, just to reassure us and them that they're not carrying this virus, and we'll do a sample of those. Similarly, we'll be looking at some healthcare workers, again with their consent and in partnership with their industrial organisations. And we'll be doing a range of other cohorts from time to time, just going out and sampling parts of the community just to assure that we are not seeing asymptomatic transmission. We know that there are some people who do have the virus detected without symptoms. We still don't really know whether they transmit the virus effectively or not. We still think that most people who are transmitting the virus from one person to another actually have some symptoms. That's why I say again and again and again, anyone with a cough or a cold or a sore throat or a temperature or a runny nose, please get tested. That plus downloading the app and sticking to what we've asked you to do makes the country safe for you. So I'll stop there. Thanks, Pam.
Thank you very